Hello everyone, I'm Dr. Niti Raizada. I'm Senior Director of Medical Oncology and Hemato-Oncology at Fortis Group of Hospitals at Bangalore. I'd like to speak about Genito-Urinary Cancer, which means the cancer in the private parts and the pelvic area of a human being. Now the common male cancer is prostate cancer. Prostate cancer happens to be one of the important cancers globally. In fact, even in our country, the number seems to be rising. We have significant numbers in the West, but interestingly, this happens in older men. Hormone responsive tumors are very common, and therefore very basic hormone manipulation can treat prostate cancer very well, and some of them are also cured with only hormone therapy. So first thing is confirm with a biopsy, do some special test known as immunohistochemistry. We try to do scans which are prostate specific. They are known as prostate specific membrane antigen scan, known as PET-CT, directed towards prostate. This stages prostate cancer very well, and then we determine whether they are hormone sensitive, where we give hormones, or they are castrate resistance, where hormone therapies do not work, and therefore we try to give either chemotherapies or newer therapies which are known as theranostics, which is a therapy directed towards a diagnostic modality. Sometimes focused radiation is given, focused surgeries are done for metastatic disease as well. And all of them have made the treatment extremely useful and extremely beneficial, increasing the length of life to a very significant extent. The second common genitourinary cancer is kidney cancer. Now we know that we have a couple of kidneys in our body which is involved with the filtration process, and 30% of all kidney cancers are localized, which is only restricted to the kidney, and quite often we find incidental finding of a kidney cancer. In these, a nephron sparing surgery or a partial nephrectomy is what is recommended. 30% of cancers actually progress to advanced stage, and 30% of all kidney cancers present as stage 4, known as metastatic cancers. Again, renal cell carcinoma or kidney cancer is a very unique cancer because it's known to be an immune-directed cancer, and in which the current therapies include biologic therapies and immunotherapies only. There is very limited role of chemotherapies or other type of therapies. Third is urinary bladder cancer, which happens in the urinary bladder, and it can be treated either with surgery, which is more often bladder conserving surgery known as partial cystectomy, or parallelly chemoradiation can be offered. This is another subset of cancers in which immunotherapy has a very emerging role. When we talk about women cancers, well, uterine cancers was until now thought to be cancer of the Western population, but it's again emerging cancer of Middle East, of Asian countries, and of course African countries as well. And often it is a good risk histology in which surgery followed by hormone therapies work very well. Radiation may also be required from time to time, and an advanced endometrial cancer again requires us to give precision therapy by finding out whether they are expressing TP53, poly, or MSI, which is known as microsatellite instability, in which cases immunotherapy can also be offered. Now we all know about cervix cancer, and it used to be one of the most common gynecological cancer worldwide, associated with personal hygiene and also sexual partners. Well, this is also a cancer, interestingly, which is known to be a revolution in current world, in which human papillomavirus vaccine, starting from 9 years of age, has actually kind of eradicated HPV, and which will translate into cervix cancer reduction in number globally in a significant way. We have seen this trend in many countries, and we are waiting to see more trend in our countries as well. So cervix cancer is again a curable cancer. In very early stage, surgery is recommended. In most other stage, chemoradiation is recommended. When it is advanced or spread to other organs, there's also a role of biologic therapy like bevacizumab or immunotherapy like pembrolizumab. Thanks.